pretty sure my house is undergoing structural renovations right now. Perfect. Yeah, there's no way I'm gonna hide this thing. We're just gonna pretend it's not real. Hi, my name's Sava, welcome back to my channel, and today I'm here to talk to you about 5 things that I wish I knew before I started medical school. I am in my final year of studying medicine here in Ireland. I study at UCD. I wanted to talk about a few things that I wish I had known. Now, I want to make it very, very clear. I am incredibly happy and I love studying medicine, and I'm so excited that I get to be a doctor, so I don't want this to come across as that I wish I hadn't studied medicine or that any of these things that I'm about to talk about would have actually deterred me. It just would have been nice to know. Without further ado, the first thing I want to talk about is I started medicine when I was a fresh little 18-year-old. I came from a school that was a really broad range of academic abilities. I had never been in a room with 100 people who were just as academic as I would have been. I was very intimidated by this straight away. And I assumed that just because everyone else was really intelligent, that meant that I wasn't. And so from day one, I viewed myself as inferior to everyone else and tried my best to cover that up. So classic imposter syndrome. And it really affected my self-esteem and actually my performance for my first 3 years of medical school, and also my mental health. So the first thing that I want to say is that if you have been accepted into medical school, or if you're starting to study medicine, the last thing you want to do is question yourself and question whether you deserve to be there, because that's going to do absolutely nobody any good. What would have been much better for me would have been getting some therapy, maybe, to talk about those self-critical thoughts that I was having, but also to expend my energy into actually learning the things that I was interested about. Instead, what I was doing was I was worrying and wondering about what everyone else was learning all the time, and not actually putting any time into my own studies. Genuinely, the same cycle happened every semester where I said, you know, from week 1 I would be really good, but then I just feel completely overwhelmed and feel like everyone else knew more than me. Our semesters were in 12-week semesters, and you would get to week 11 and I would absolutely panic, and so I never performed as well as perhaps I could have. Maybe I never would have done any better than what I did, because I'll never know that. Since realising that I'm not really stupid in comparison to everyone else, it's done wonders for both my mental health and my academic performance. Also, before I started, doing well academically was just a given for me, and that's not to sound braggy, it's just in my circumstances. It was very strange if I didn't do exceptionally well, whereas then I was in an environment where you had to be exceptional to do exceptionally well, and I wasn't putting that work in, so I was fulfilling my own cycle where I wasn't good enough because I wasn't getting the results I was used to, but I also wasn't putting the work in. Before I started medical school, I wish I could go back and tell little 18-year-old Sava, focus on you. You deserve to be here just as much as anyone else. Just get it done. You don't need to worry about what anyone else is doing, just worry about what you're doing. That is the first thing I would want myself to know before I started medicine. A bit of a change of scene, you know. The next thing that I would have loved to know is how to study properly. So this kind of ties into my first point. When I kind of got to the end of my semesters and I was cramming, every time I knew that it was the wrong approach and I knew that it wasn't going to help me, but also I wasn't being very efficient with my time. It has taken me until I was literally a quarter of the way through my final year of medicine before I found and started using the strategy that actually works for me. And that's different for everyone, I will accede to that, absolutely. But we know from a lot of high quality research now that active recall and spaced repetition are the most effective ways of studying. I learned that, and it took me about 2 years to actually come around to the idea that I didn't have to rewrite all my notes 100 times, and I didn't have to make them look pretty and spend a lot of time doing that. While there was an enjoyable aspect to that, I would always be entirely overwhelmed. Now, I don't want to say it. In Ireland, using Anki is kind of a, you just don't do it. But it is what works for me. I am going to be using that method to study for my finals, whatever form they take. And while, even if I don't get whatever high grade on my finals, everything that I am learning at the moment is hopefully going to be relevant to me as a doctor, which is really exciting now. So I wish, even in like second year, someone had just shown me, like had told me, or I had just searched it somewhere, you know, what is the most effective way of studying, because I just thought oh, you know, I'll do what I always did. And it didn't work, and I just kept doing it anyway. And we are, again, there are so many YouTube videos out there. Ali Abdal's is the first one that comes to mind. I will literally link it down below. We're really bad at assessing what study strategies actually work for us. So I did that, and it would have saved me so much time, so much hassle. Probably would have helped my mental health quite a lot, because my process is so much more streamlined now, and I don't feel as much under pressure. So if you feel like you don't know what you're doing, like in terms of your studying, if you feel like you haven't figured out what works for you, please, 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 please give active recall and spaced repetition a go. I tried loads of different ways. I tried loads of ways before turning to Anki, but Anki is just, it's the most simple way of doing it. For me, it just means I have minimal decisions on what I do. I just do my Anki every day, and I add cards to it when I want to, and that's it. But there are loads of different methods out there. If you want to go for it, do it. So that is my second point. I wish that I'd learned how to study effectively for me before a quarter way through my final year of medicine. Oh, the next thing that I would have really liked to know, and again, this wouldn't have stopped me from pursuing this career, but it was kind of a shock to the system. So in Ireland, there are multiple different ways of going into medicine. We have an undergraduate route, which means you go straight from our secondary school, or you can do graduate entry, which is much more expensive, but you'll have done another undergraduate degree first and then gotten into the graduate program. There are other ways even to that. In Ireland anyway, no matter what way you do the first 2 to 4 years, so a graduate program is only 4 years total, so the first 2 years are learning and lecture based. Yes, they are. But in the undergraduate program, the one that I did, I had a 1 year of pre-med, which was a basic sciences year, and then I had 3 years of lectures and some clinical learning in there, but not really. And then the final 2 years, as it is in the States and in Canada and in most places, as far as I know, the final 2 years are completely hospital based. That's my long-winded way of saying I would have loved to have known what the structure of my clinical years would have been like, and the way that I was examined throughout them. Hello. The way it works in UCD anyway, where I attend, we don't get our placement information. It's not all given to us at the start of the 2 years. It's kind of given in dribs and drabs. So you might find out where you are for 12 weeks at a time, then you might find out where you are for the next 6 weeks or whatever. It depends also on which hospital you're placed in, but you also have to attend hospital placements outside of the area. So you could be put in a number of hospitals or clinical placements across Ireland, essentially. The furthest one is about an hour and a half, 2 hour drive away from Dublin, where we're based. Sometimes it can be quite stressful, because you might find out on Wednesday that you're actually somewhere 2 hours away on the Monday. And unfortunately for us, the accommodation that is organised is all hotel based, and so you don't have anywhere generally to cook food or microwave or anything, so you're always ordering out or having to eat out, which became really stressful during a pandemic then. I would have liked to have known that for sure, just because I'm someone who really gets stressed about these things. And the thing is, I know that maybe me knowing 2 weeks in advance where I'm placed it doesn't change the outcome, but I think it would change how I feel about it anyway, just having a bit more preparation. But also I would have loved to have known that I wasn't just going to be in one hospital for the entire 2 years. I didn't have any understanding of that maybe like 3 months before we started. And as far as I know, that is similar in most learning sites in the Republic of Ireland anyway. I'm not sure about the North. So I would have liked to have been aware of that. Then it's how we are examined, which is the same worldwide as far as I know. You know, you're examined clinically, you're examined in person. Up until our 4th year, all of our exams were written exams. The concept of doing a physical exam and taking a history and everything like that in front of a consultant was terrifying to me, and I didn't really realise again that it was going to be happening until not very far before it. Luckily I have lots of friends in the year ahead of me who really prepared me well. Shout out to them, because I don't know what I would have done if I hadn't known, you know, at least from them. Oh, bye. The way that we are examined is very stressful. That's the same for all medical students, and it's the way it should be, because we need to be assessed in person. You know, I find myself thinking every time before I go and do a clinical exam, I get really stressed about it, and I literally find myself thinking, why am I doing this to myself? I did not know this when I was signing up back when I was 17, and I put this course number 1 on my CIO form, and I didn't know. Again, that's me being really dramatic. as always, there's nothing new there. And to be honest, I actually, once I get in there, I really tend to enjoy them, and they're never as bad as I think they're going to be, except for my peds one. That was a no-go. That was a bad time. Maybe I'll tell that story sometime. The rest of them they have all been fine. Like, they're never as bad as I'm afraid they're going to be. And the thing is, after speaking to my friends, everyone's the same. Everyone gets worried about them the same way. So it just would have been nice to know a bit about that. So the final thing I wish I knew before starting, I never know whether to call it medicine or med school, because I don't know. I don't know what to call it. My college course. So I have my laptop here because this is the point that I want to make that is quite technical, and it has quite a lot of moving parts to it. So basically, I wish that I understood how postgraduate medical training works. In Ireland, when you qualify, you do 1 year working as an intern. So as an intern, you rotate through 4 3-month jobs, sometimes 3 4-month jobs, and not really in Dublin though. And once you finish that intern year, you are then a fully qualified doctor. Like, you're fully registered to be able to pursue specialty training then. Didn't know that. Hadn't a clue. Then after that, you can start going into your basic specialty training, is what it's called. And you can pick whether you want to do pediatrics or GP or psychiatry or obs and gynae or basic adult medicine or basic adult surgery. I think that's all of them. I could be wrong. I have done some research, but again, don't quote me on any of this. And to do that, you have to apply onto a scheme that only lasts for 2 years. And in that 2 years, you move around every 6 months. So you're not going to be in the same place all the time. After that, you need to apply to another thing, which is a higher specialist training scheme specifically for what it is that you want to specialise in. So say if I wanted to do nephrology, which is something I'm interested in, I would have to do my intern year, then I do my 2 years of my basic specialist training in medicine, and then I need to go on and specialise in nephrology, a 5-year specialising thing. And in those 5 years, you have to move around hospital every single year around the country. This causes issues for doctors for a number of reasons, one of which is that because until you are on your higher specialist training or further on route, it's really difficult to get a mortgage because you don't have a permanent contract, or you don't have a way to show the bank, I have this permanent job. Your contracts are for 2 years or for 1 year or for however long they are. People get around this. It's not the end of the world. It's just a little bit harder than it would be, say, if I was a nurse and I just had a permanent job in one hospital and I knew I was working on that ward or whatever. The other thing that means though is that it's really hard to find a place or to settle down because you move around so much. So I met a doctor who was specialising in nephrology as well, and she had bought a house with her husband in a city in Ireland 2 years prior to when I met her, and she hadn't gotten a chance to live in it yet. Her husband wasn't a doctor, he worked in that city, but she hadn't gotten a chance to live in that house because she was moving around. So she was paying obviously for the house that she was living in with her husband, and also paying rent to live near to where she was working. Again, it's not the end of the world. I'll deal with it. Everyone finds a way, but I wish there was maybe a way to make things more location based so that, you know, you could. A lot of people don't want to be buying houses in their late 20s anyway, or to be settling down, don't mind moving around. But it would be nice to be able to do that. Oh, the other thing, to become a consultant in Ireland, being a consultant isn't like a qualification, so you don't like pass an exam and then you're a consultant. So you finish your higher specialist training, and once you're finished that, then you have the correct qualifications to become a consultant, but a consultant post is a job. So you're not a consultant until you get a consultant job. And a lot of people, to make their applications more competitive for consultant posts, they do years abroad. So again, back to that trainee that I was speaking with who hadn't lived with her husband for 2 years. She was going on 2 weeks after I met her to move to London for a year, which wasn't a part of her training scheme. This was for her to further her learning. And absolutely, in Ireland, if you want to specialise in something specific, it makes sense because we don't have a huge patient population, so we don't see the really rare things. We don't see them enough to be able to glean a best practice from it. So if I'm only seeing 1 or 2 specific conditions a year, I'm not figuring out how best to manage them because it's not a large enough patient base, and I'm not learning from someone who treats 100 of these patients a year, which is what you would be doing, say, if you went to England, where the population is much larger and you have your tertiary medical centres where if you have an interest in a specific condition or a specific subset of conditions, you will be able to see more people because the population of the country is increased. The number of patients who have certain diseases is also going to be increased, and Ireland is really small. I would definitely have liked to know that. The moving around, the lack of stability. I really like stability, and I had a very different idea of what that was actually going to be like before I went in. Next thing I wanted to talk about is how much you have to put yourself out there and how much you have to present in front of your peers and other doctors, and how much you really have to chase and seek learning opportunities when you're in the hospital. This again ties into my third point about what hospital learning is like, but really your learning is in your own hands from in your final 2 years, because you know, you could just float along and watch what everyone's doing and what's going on. And doctors always have medical students, so they're not always going to remember to ask, oh, do you want to take these bloods, or do you want to do this, or do you want to do that? You have to really be proactive in seeking out your learning opportunities. And there are some days where absolutely I'm like, let's get this. I want to go get histories and I want to find someone to present them to, and I'm ready for this constructive criticism. I'm not going to go home and cry about it later. But then there are some days where I'm like, absolutely not, bare minimum.
Let's drag myself through this in whatever possible way I can.
I don't necessarily disagree with like that method, because I think, you know, we're all adults. We can't be babied around a hospital when there are people who are there doing their jobs, literally taking care of patients, and it's not their job as well to like make sure we're all in at a certain time and like take our role and ask us, oh, how many times have you done this or whatever. We do all have to take responsibility for our learning, but you do have to be very self-motivated. And there are definitely some days where I walked in and I was like, I cannot make myself do anything like useful today, because you have to put yourself out there, and like, you know, you have to be ready to take no as well. You might ask a doctor if, you know, you could maybe come with them to do something, or if you could maybe try taking bloods or placing a catheter or whatever, and they might just be too busy. Like, they might literally have 20 of them to do, and they don't have the time to like take you aside for 10 minutes and talk you through the process and then talk you through it with the patient. You're going to be told no sometimes, and 99% of the time it's not personal, it's just that doctors are busy and they have jobs to do as well as trying to teach you on the side. So yeah, I definitely would have liked to have known that, just because it's okay to have some of those days where like, I'm absolutely going to I'm going to follow these people around. I'm not going to put myself out there to do anything extra today, you know, or maybe like scrubbing in theatre or whatever. Like, there's some surgeons who are like, is there a med student in theatre? Yeah, you're scrubbing in, let's go. And there are others who would never ask, just because there might be 4 surgeons already scrubbed in. So if you want to do that, you have to ask and be like, hello, I'm Sava, I want to scrub in. And that was never me, I'm not really a surgeon. You have to chase their own learning opportunities. From me and Scout, those are the 5 things that I wish I knew before I started studying medicine in Ireland. Again, I'd like to make it clear, I absolutely adore my course. I feel so lucky that I just happened to sign up and to get in, and now this is going to be my job. I feel so lucky. If you have anything that you wish you knew before you started med, let me know. Comment down below. Don't forget to like and subscribe. I can't believe I'm saying that out loud. But anyway, okay, and I'll see you in the next one.